Engineering, accountant, stripper, fast food worker? What other careers did I try? Welcome back to the Momma Nurse channel. I'm Vanessa, and today we're going to be talking about why I chose nursing and what other careers I tried in the past. So before we get into it, don't forget to like, comment, and subscribe. I hope you're enjoying these videos. If you're not a nurse, or if you are a nurse, go ahead and drop nurse down below, or whatever career you're in, so that we could get some conversations going. So this August marks my 6-year mark as a nurse. This is the month that I took the NCLEX and passed it. So it was when I officially became an RN, and then I began my first job on September 1st, 6 years ago. So pretty much I've always wanted to be in the healthcare field. Originally, when I was like a little girl, I did want to be a pediatrician. But then honestly, I didn't want to be in school that long. So I knew I wanted to help people. I knew that I had the caring heart to be in healthcare. So I ultimately decided to become a nurse. Basically ever since I was little, I would say. Nursing is such a rewarding career. You get to see your patients recover in some cases. Sometimes you don't, being that they may move on to like a rehab or things like that. But a lot of our patients do come back and show us an update on how they're doing. Or we'll even send in letters or little thank you cards for the care that the nurses and techs on the unit and even the doctors gave them while they were there. So that's very rewarding. Family appreciation. Don't get me wrong, you don't always have those fairy tale endings. You have patients who pass away. But for the most part, when it is a positive outcome, you can really get that appreciation from the patients and the families. Not always, but it is appreciated, and it does make you feel good when somebody thanks you for just doing what you were made to do. The prestige in society is pretty nice. People automatically trust you being a nurse, which is a good feeling. You're looked at in a higher standard as a nurse, and it holds a lot of weight in society. So that's rewarding as well, as along with the knowledge base that you have. Nurses know and learn so much in school and when you get out into the real world. So I never really realized how broad nursing was, but I know sometimes at home my spouse will quiz me just randomly. He'll just throw something out there and see if I know it, and it's crazy. Even though I've always been a pretty intelligent person, it's crazy that when he does do those little quizzes, I know exactly what he's talking about. So that's a good feeling. So the knowledge base that you have is so broad that it's kind of a confidence booster. So that's always nice. Along with the knowledge, you never get bored in healthcare. Another job that I thought about when I was trying to make a career path for myself was accounting. I've always loved math, but I could never see myself just sitting at a desk doing numbers all day long or for 8 hours. It just didn't seem right. I knew I would get bored with that. So in healthcare, you always see something new. If you don't have something new going on with your patient, your neighbor nurse might have something cool going on. And on my unit especially, we like to learn from each other's patients. So if you have something interesting or something that we don't see often, we'll broadcast. We have these little voceras, and we'll broadcast, and anybody that's available that wants to come do a dressing change or do pin care or trait care, things like that, you just broadcast it, and whoever wants to learn will come over. Opportunities. So I do that quite a bit because I am a preceptor as well. So when I'm teaching somebody something new, I'll go ahead and broadcast to get anybody else who hasn't seen that activity or that task or skill, they can come in and learn as well. Many avenues in nursing. You have mother baby, you have med surg, you have cardiac, pulmonary, dialysis, ICU, ER. You have so many different avenues in just like the basic nursing realm. Then you can also climb the ladder a little bit, move on to charge nurse, manager, or ARNP, and things like that. So there's so many different avenues that you could go into as a nurse, that if you do start to get bored, you can venture out and find something else that sparks your interest. So that's always nice. You never have to feel like, oh, I'm a nurse, I can only do this one thing. No, don't feel like that. Don't get stuck somewhere for 10 years if you're not happy. You have so many different opportunities to grow and learn and venture out. Don't let anyone or any facility or anything hold you down. Venture out if you're not happy anymore and find what suits you. Love about nursing, I can advocate for my family, my children, and my loved ones. If anybody has healthcare concerns or issues within my scope of practice, I can give them advice or give them my take on what's going on for them. I know, like, when I delivered my son, my first son, his blood sugar was low. So I had to make that decision on, was I gonna let them give him some fluids or anything like that, or was I gonna just go ahead and breastfeed him and get him situated from there. So you can be an advocate for yourself, your family, and your loved ones, so that's always good. You don't really have that fear. Nursing has always truly been my passion. I've had 3 careers in my life. I was a waitress in high school. I became a CNA from there, and then I became a nurse. So those were the only jobs that I've ever held, and it's been the best path for me. I'm also very good at what I do. I love nursing. I love healthcare. And if you love what you do, you don't have to consider it work. So that's it for this video. I hope you guys enjoyed it. Don't forget to drop down below if you're a nurse, if you're an entrepreneur, if you're an engineer, whatever your career path is, if you're a mom, go ahead and drop that down below. Don't forget to like and subscribe to our channel. And until next time, stay safe, be well, and live life.